Hi everyone, thanks for taking the time to join us today for this webinar on mental health, the NDIS and people from multicultural backgrounds. My name's Liz Wilkinson and I'm a project manager with the Mental Health Coordinating Council of New South Wales. Before we begin, I'd like for us to each take a moment to acknowledge the custodians of the lands on from which we're all joining today. So for myself, I'm joining from Gadigal land and the Eora Nation, and I'd like to pay my respects to their elders past, present and emerging, and also acknowledge their continuing connection to land, water and culture. A quick note on admin for today's webinar is that you can just sit back, watch and listen. But if you'd like to interact with us, you can ask a question. So to do that, just go to the bottom of your webinar box and click on the Q&A function and then submit a question through there. Next up, I'd like to acknowledge that today's webinar is brought to you by the Mental Health Coordinating Council as part of our Reimagine Today project. We're doing this webinar in partnership with the Multicultural Disability Advocacy Association. And we've also got people today sharing from their lived experience as well as a guest from the Community Flower Studio. One of the things that's important to note today is that this webinar is brought to you as part of the Reimagine Today project. Reimagine Today is a resource to support people with mental health conditions with accessing the NDIS through the psychosocial disability stream. We've been working over the last couple of years to make the resources more accessible to diverse communities such as people living in rural and remote areas, Aboriginal and Torres Strait Islander people, LGBTIQ+ people, and people from multicultural backgrounds. So this webinar focused on people from multicultural backgrounds is part of the work that's come out of that project. At this point, I'd also like to take a moment to acknowledge people with lived experience of mental ill health or mental distress, as well as their family and carers, and especially those online today, and thanks for joining us. The role that we each play in the reform of the community and mental health service sector is invaluable, and I'd like to thank you all for your contributions and encourage you to continue fighting. So what are we going to be looking at today? Some of the barriers people from multicultural backgrounds, in particular with mental health conditions, face when accessing services like mental health services and in particular the NDIS, overcoming some of those barriers, both with NDIS access in particular, as well as once you're in the NDIS, some of the barriers with service access with the NDIA themselves, with LACs, etc. Some of that will be very practical advice and covering on scenarios and listening to people's personal stories of accessing the NDIS and general mental health service access. And we're also going to quickly touch on resources that are available to support you. Now, I would like to welcome Dr. Bibiana Chan, who is the founder of the Community Flower Studio. And Bibi has a wealth of experience, both through her own lived experience, as well as her work in mental health and around the NDIS. So welcome, Bibi. Oh, you're still on mute.
Hi, everyone. Thank you for joining this webinar. And I wear several hats today. I have lived experience of clinical depression. I am also a mental health researcher since 2000. And I'm now a mental health service provider through a not-for-profit social enterprise, Community Flower Studio. And I chose this gigantic waves as the imagery for barriers for accessing mental health services for 3 reasons. They are huge and powerful and created this fear in you to not even try to access services. waves come one after another. When you think you have jumped through a barrier, another one is waiting for you around the corner. And thirdly, in order to overcome the fear and not get tired by this frequent occurrence, the best way is to ride on top of the waves. And we have to have this really positive mindset and take on the challenges and turn the experience into part of the recovery journey. And I will share with you some of the common barriers faced by CAL communities when accessing mental health services. And I'm sure some of you will know too well or experience them when trying to access services. And before I do that, I want to illustrate with some concrete example of the not too obvious systemic barriers. I mentioned right at the beginning of my own clinical depression. It was officially diagnosed in 1998, and I was a very good patient. I take all my meds and do the right thing. And when I got back on my feet, I attended the CAL support group at the Transcultural Mental Health Center. This was the first step of my recovery journey. I am trying to ride on top of the waves. And I was hungry for cultural knowledge about why I didn't seek professional help earlier, why I'm so ashamed of my mental illness. I published a master thesis called Cross-Cultural Issue in Clinical Depression. And my conclusion is, hey, psychiatrists, you have to share your power with the patients and listen to their voices. So this was my first declaration of consumer empowerment. You can see there are systemic barrier is the mindset of the very person that care about you, that treat you. They have too much power in their hands. They have to let the patient to share some of their power. So this is what I meant by ride on top of the wave to break down barriers. So in 2007, I handed in my PhD thesis. This time I wrote about very specifically depression through the Chinese eyes and a window into multicultural mental health services. And then I was so enthusiastic, I quit my research job and jumped into a newly funded federal project called Multicultural Mental Health Australia, MMHA. It's a bit of a mouthful, but I hope to work with grassroots organizations to empower fellow consumers. That same year, I organized a professor visiting from the US, and he shared with us the new concept of recovery model. And I was fascinated by this new concept. However, the bureaucratic red tapes of MMHA suffocated me. 80% of my time was wasted on dealing with office politics, hospital politics, state politics, and federal politics. So what am I doing? I returned to work in research and published a few more journal articles. But very sadly, 3 more of my MMHA colleagues also left within 12 months. And those people like me, like my colleagues who were passionate about making a difference to the mental health services for people from CAL background were disheartened and replaced. So this is the systemic barriers. That is the political will, people who are really wanting to do some work and they didn't get their way. But I did not give up breaking down barriers. I was waiting patiently for the next wave to ride. And in 2010, I was really lucky to be awarded a Churchill Fellowship to learn about peer-led recovery program in North America. So this is another barrier. So we want the psychiatrists to share the power, and now we want to be in the driver's seat. We want to lead as a peer how recovery program should be run. Okay, so fast forward a decade later, 2019, I found this not-for-profit social enterprise called Community Flower Studio. Next slide, Liz. Yeah, so, well, this is when I have the opportunity to learn how to arrange flowers. I did a TAFE cert-free forestry, and now we are just making flowers and doing some terrariums, and this is a mental health program in disguise. There's no stigma attached to, making flowers, making bouquets. So we are here to overcome barriers and to access service. And I'm now actually providing mental health services. And this is what I call the community, the support, and through creativity, we can break down a lot of barriers. So we help each other to find resources to foster a growth mindset. And I hope that you will also have this really positive attitude of riding on top of the waves and breaking barriers. So next slide. As I said, you may have experienced a lot of the barriers when you access service. A very common one is English competency. I share with you when I was in my relapse, when I was really in the deep depression, I can't even carry a conversation in English. So there you go. And a lot of the collectively oriented culture, they are very tight-knit. And confidentiality, how can you make sure that the story that you told your service provider or the translator won't get shared among other your friends? Stigma, I mentioned stigma before, and the lack of advocacy. A lot of the culture teaching that we have to put our self-interest behind and leave it to the common good. So this is another barrier to accessing service. And gatekeepers, there are a lot of gatekeepers. The medical receptionist can be a gatekeeper. The politician, the decision makers, they are the gatekeepers. But specific to NDIS are the inconsistency of decisions that are made by the local area coordinators. And a lot of this is to do with training. So I will leave these barriers, these really common barriers at this stage, and we can discuss that more. And some of the other panelists will share with you other barriers. Thank you very much.
Thank you so much, Bibi. There's a lot to cover in a short time. And I think that your comments there really set the scene for sort of some of our conversations that we're going to continue to have. So thank you. Next, I'd like to welcome Frida Omar, who works for the Multicultural Disability Advocacy Association. And Frida's going to further sort of explore some of those barriers and how to overcome them, especially in the context of the NDIS. So welcome, Frida. Hopefully Frida's going to join. I'm not sure if Frida's not there, then I'm not sure if Harley, whether you're able to cover any of this stuff or whether we might.
I'm on.
Okay.
Hi, I'm so sorry. We were just having a little bit of technical difficulties here.
No problem. Busy office over there. All right, I'll jump off. Thanks.
Thank you. Thanks. So my name is Frida and I'm here with my colleague Harley. And today we'll be talking to you about CALD communities and the challenges they face when it comes to the NDIS, especially in regards to psychosocial disabilities. So if you want to go to the next slide. So our background, we work at the Multicultural Disability Advocacy Association. So these are just some of the services we have. We are a statewide service, and at the end of my presentation, I'll have our details. So if anyone has any further questions or would like to refer anyone to our organisation, please feel free to do so. Next slide. So I apologise, it's a lot of text, but there are a lot of challenges that people do face, especially CALD communities, when it comes to applying to the NDIS. So families being unfamiliar with the process and lack of social supports. So a lot of people are just unsure of what the NDIS is and who can help them. As Bibi mentioned before, the cultural stigmas with openly talking about disabilities. So I know within my culture as well, we don't openly talk about disabilities. It's something that's kept within the family. There's also physical disabilities versus psychosocial disabilities. So with the NDIS, whenever they do advertising or promotions, they've always seemed to be using someone with a physical disability. So sometimes people with psychosocial disabilities are just unsure if they're able to access the NDIS or if they're even, if they'll even qualify. distinguishing between a medical condition and also a permanent disability, and also if you're a recipient of the disability support pension. So sometimes people think that if they are getting the disability support pension that they automatically can get the NDIS, which is not true, unfortunately. And also distinguishing between a medical condition and a permanent disability can be a little bit difficult as well. So again, another challenge that Bibi mentioned was confidentiality. So a lot of people are worried that private information will be leaked to community members, not wanting help as it's the family's duty culture, unsure if they are eligible, especially regarding psychosocial disabilities and certain visa statuses. Gathering and providing evidence required for the access request form can be challenging just within itself. The access request form at the moment is 28 pages long and it's in English. The NDIA will not provide interpreters, so if you were to call the NDIA and tell them that you cannot speak English, they will ask you to call back with an interpreter. Accessing an interpreter can be difficult as the initial prompts when you call an interpreting service is all in English. And also families' lack of understanding the review process and asking for a review as well. Next slide. So some of the tips that we've come across that can really help someone applying to the NDIS are, firstly, is to look for services out there in the community that can help you apply to the NDIS or even understand what the NDIS is all about. So there's Multicultural Disability Advocacy, which is us, MDA. There are other services just like us in the community. There's also the Community Connectors program. That was a funded program to target specific multicultural communities in the area and teach them about NDIS and help them access the NDIS as well. And then there's also internal linkages and capacity building, ILC, and other service providers. So the important thing to note is that the NDIA is looking for permanent disabilities and how the disability impacts a person's life. So you really need to have evidence, medical evidence in particular. So it's important also to know that no diagnosis is required if you have a psychosocial disability. So providing medical reports and things like that will be enough. You are allowed to ask for the access request form to be provided to you in your own language. This is not common knowledge and not many people know this, but it absolutely can be done. It might just take a little bit longer. The better your evidence is, the better your chances are of accessing the NDIS. So the more reports you have, anything to do with your disability and how it affects you will give you a better chance. You have the right to have a support person with you in all interactions and have the right to an interpreter. These are your rights and you should exercise them if you feel the need to. And the last point here, which I think is very, very important, is in regards to answering the access request form. So there'll be a lot of questions in there and they'll ask you specific things. But when you're answering those questions, it's really important to think about your bad days. So people have good days and some people have bad days. But when answering these questions, we want you to focus on your bad days. So for example, if on the access request form, it asks you about, are you able to walk 100 meters, 200 meters. Physically, you might be able to do that, but sometimes your disability means that emotionally you're unable to do so. So they're the types of things we want people to focus on. Next slide, please. And so we've got a few tips as well for support workers and organisations who are supporting people from CALD and non-English speaking backgrounds. So we encourage, and what we do as well, is allow families to have control and choice by asking the person or the family if they would like a service provider or a support worker who is of the same culture or not of the same culture, just to respect the privacy issues. Recognise and assess signs of distress. So if anyone's feeling distressed or uneasy, they are unable to make decisions, and that's really important to be able to have a trusting environment. Emphasis on their rights. So we always remind people that they have the right to provide feedback, to make complaints, privacy and confidentiality, which is a really big thing for us. We always offer an interpreting service or referrals to relevant services as well. We respond effectively by using appropriate language and communication skills, provide literature in easy plain English and or in other languages, and also allowing families to communicate in the way they would like to communicate, whether it be face-to-face, over the phone, via email, any way to respect their cultural needs. Next slide. So failure to do these things will result in people feeling uncomfortable, fearful, overwhelmed, not wanting to try after a failure. So if they get rejected, they just want to give up and not try again. Offended, misunderstood, or unable to understand what's happening, and also in some cases feel like they've been treated unfairly or unjustly. And these are just common problems for CALD communities, and these are increased if the person is female, identifies as LGBTQI, or a young person or a person that's living with a disability. So there are our contact details if anyone wants to contact us. But again, when Harley does her part of the presentation, we'll have those up as well. Thank you.
Thanks so much, Rita. There's a lot to cover in a short.
Yes. Thank you.
And yeah, definitely some eye-opening stuff there, and as well, I hope helpful to some of our listeners. So next, I'd like to welcome David Yang. David's actually been involved in the Reimagine project for quite a while now, and David's been very generous in his sharing of his story, and I'm grateful that he continues to share with us so generously. So David, welcome.
Okay, thank you, Liz. My name is David. I'm a person with a severe mental health problem. And today I'm talking for my experience with NDIS. For my enter the NDIS program, that was very easy. Okay, but after I joined the NDIS, all the problem, all the things like that one, is frustrated and so upset for me. And even my English is some kind of enough to get the barrier for some people like my Chinese background. They don't know the English, but like the first things I joined that half year, I can't find where to get the a planner, all the things, and I don't truly to know what kind of the service, all the things. There's nothing. With some people and organizers help, so eventually I got the plan and do the interview. This already roll out 2 months after my area rollout, so I got that service. Then I got the service. Okay, it's another problem. Even I can't find at time I remembered for the plan manager, and even you got the coordination, all the things like even the coordination is hard to find like my Chinese background people or something. So I use the English, the people, all the things like that. Still, that's very hard. You can think it's a cultural background people. Their choice is much worse. So another thing is for the mental health. My plan every year is so different. That's I don't know what kind of the NDIS criteria for us to give you money or something. Sometimes they give okay, sometimes even very high, so high you can't imagine, and sometimes that's money you another end. Okay, like last time I made a review. I did the review and make a complaint. I didn't provide any new information. Okay, after the result is 4 times more than my original one. That's the thing is, I thinking back, you know, when I joined NDS, I have questions of why and how they decided to let me in. So that's we need to work out. So for the mental health, I think NDS should be have some things, you know, to make us to understand why I got money, why I. So all the assessor, all the people, they have so much difference. Okay, this really frustrating. Like this year, last year they gave, I think it's too high. So I didn't finish use that one. But when you didn't use all the money, they cut. So that's another problem. I did the complaint and ask a review this year again. Another thing is when you assess the service, even like me, and I rather choose my language, you know, the provider like a psychologist and the OT or something. Then that is limited for me and for us to choose the service. That's a huge problem. I run a Chinese disability peer support group in my area, so I see all the other people is so hard or something. And also NDS, that's their policy or something. They really give some people, they can't assess the NDS, they worse off. Like for example, the psychologist. If you can't access to the NDS, okay, you use really on the Medicare. Yes, I think now I don't know how exactly, but before it's $85 per session for the psychologist, but for NDS, it's double that one. So with people with no NDS, they can't find a psychologist. They have to go to the public hospital and wait for a long time. But for the people, okay, if you can't get access that service, and that means even harder for you to let the NDS assess you all the things you support like medical report, and there's nowhere you find one. And if you spend your own money, okay, like the people with disability, all the family, maybe you know how hard financially. So we just say, okay, we need the NDS to change their criteria, all the things like that, to assess the mental health people. And they have not like, you know, some people just based on their own judgment and then give all the things like that. That's my experience for the NDS. Thank you.
Thanks very much, David. I was about to say you had a minute left, but you've cut yourself off very well on time. Yeah, definitely a lot of challenges there, but I think, yeah, that hopefully sets the scene for also what Harley's going to talk about shortly. And I think my understanding from my discussions with you, David, is that, you know, there's still a lot of supports that are worthwhile with the NDIS, but there's a lot of challenges to navigate there, and appreciate you sharing your story of that. So yeah, next I'd like to welcome Harley Trickett, who also works for MDA and is going to be continuing the conversation around overcoming barriers, but now in the context of having an NDIS plan. And thanks very much and welcome, Harley.
Hi, so I work at the Multicultural Disability Advocacy Association with Farida, and like Elizabeth said, I'll be talking about some of the most common challenges we come across when supporting people from CALD backgrounds who have access to the NDIS. So in terms of understanding NDIS plans, some of the most common challenges that we come across are around language barriers or communication challenges. A lack of understanding of the different NDIS plan management options, and a lack of awareness about how the NDIS system works in practice, because it is quite different to a lot of other government payments. So in terms of overcoming these challenges, one thing that's really helpful for people who have a preferred language that's not English is that you can actually request a copy of your NDIS plan in your preferred language to help facilitate understanding and ensure that you're getting all of the information. In terms of managing your plan, you can self-manage, you can use a plan manager, have your plan managed by the NDIA, which is agency managed, or you can use some combination of these. But it's important to remember that management options aren't permanent. So if a particular option isn't working for you, for example, if you're self-managing but you're finding it's a bit too much, it's too hard, you can choose to perhaps self-manage some of your plan, but also have a plan manager to help you. So if you're not confident with understanding your plan or using your plan, you can request as a part of your plan a support coordinator or a plan manager. And these people can help guide you, help build your skills, and help you to get the most out of your plan by making sure it's working for you. The NDIS provides set funds for set services and supports, so it works quite differently to the disability support pension or other government payments. And so this is something that's really important for consumers to understand. It's not going to be a lump sum payment, it's specific funds for very specific services. And there is support available to help you understand and navigate your plan and to find resources that can help you build your knowledge and skills. So some examples of people who could support you include advocates, local area coordinators, and community organizations. Next slide. In terms of accessing services, some of the most common challenges we find CALD consumers experiencing are difficulty finding appropriate services, a lack of awareness around some services. So for example, the NDIS can fund quite specific supports that people from certain backgrounds might not be familiar with, like a recovery coach, because that's something that is quite specific to the NDIS. Providers taking advantage of consumers from CALD or NES backgrounds, and challenges using the NDIS portal. So some tips for overcoming these challenges. When you're searching for a provider, it can be really helpful to think about what's most important to you, whether it's a shared language or a shared culture, whether it's a specialization in a certain area. Maybe you'd prefer working with someone who's from a different background to yourself. It's also really important that consumers understand their rights. So choosing a service provider is your choice. You can pick the provider that is the best fit for you. And if at any point you're not happy with a provider, you can change providers. You can also request assistance from support coordinators or local area coordinators to find providers, understand services, and to get support if you're wanting to change providers. If you feel like a provider is acting unethically or taking advantage of you, an advocate can support you to understand your rights and to help you try and resolve the situation. Next slide, please. If you do feel a provider is taking advantage of you or that they're treating you unfairly, you can also make a complaint to the NDIS Quality and Safeguards Commission. So there's some details just down the bottom of the slide there. When working with providers, we also recommend that you set service agreements. So basically, a service agreement outlines the roles and responsibilities of you as the participant and of the service provider. So it sets out what was agreed upon, what services will be provided, and how they'll be provided. So it makes sure that both parties understand. A support coordinator, an advocate, or an LAC can assist you to understand the NDIS portal and how to use it. And they can also connect you to different resources that can help you to build your skills and confidence in using the portal. Next slide, please. Okay, we've also got some tips for how providers and support workers can help ensure that CALD consumers are able to overcome any challenges when accessing services. So one thing that's really important is ensuring that providers are transparent and that things are explained in detail in a way that participants understand. Providing information and literature in other languages, and also providing the option of a bilingual support worker, or if the consumer prefers, ensuring privacy by having support workers from a different community. Communicating in a respectful manner and ensuring that the participant's comfortable and that they have access to any supports that they need when working with you. And allowing families to have choice and control by asking if they would like a service provider or support worker who's of the same culture, or if they prefer not of the same culture. It's also important to recognize and assess any signs of distress and to really emphasize consumers' rights for them so that they have the right to provide feedback or make a complaint, and that there's not going to be repercussions for them if they do so. It's their right to give feedback if they're not happy with the services being provided, or if they think something could be improved. And also privacy and confidentiality. So making sure people understand that you will respect their privacy, you're not discussing their personal information with anyone else. Offering an interpreter service or a referral to a relevant service, and also referring consumers to multicultural services if required. Next slide. Then some other common challenges that we have seen consumers experiencing come in terms of requesting reviews. So some of the most common challenges are a lack of awareness of the review process, what's required and what support is available during that process, and people who have received insufficient funding. So something that's quite common is people receiving a plan that maybe doesn't meet their needs. And consumers can also be quite reluctant to request additional funding. There can be perceptions that maybe you're being greedy if you're asking for more funding, which is not the case. So some tips for overcoming these challenges. Your plan is meant to suit your needs, so every plan will be a little bit different. Your plan will help you work towards your own goals and help you do the things that you want to do. If your plan's not meeting your needs, for example, there's not enough funding, or the supports that have been funded in your plan aren't working well for you, they're not helping you do the things that you want to do, you can request a plan review. The plan's not set, it can change to suit you better. It's okay to ask for a review, and there are people that can support you to understand the reviews process. So what the process will look like, what's required to go through that process if there needs to be more information provided. And some of the people that can help you through that process are advocates, community organisations, and groups such as EMDA, or even legal services. Next slide, please. Okay, and just again, if there's anything that you'd like us to give a bit more information on, or anything that we can help with, these are our contact details. Please feel free to get in touch.
Thanks so much, Harley. Again, covering a lot in a short amount of time, and I think that really helps round out our conversation. So I'm just going to quickly touch again on the Reimagine Today resources. I've mentioned over the last years we've been working to improve Reimagine Today to be more accessible for diverse communities, including people from multicultural backgrounds. And we had a couple of groups for this in Australia. One was with EMDA in Granville, Western Sydney in New South Wales, and then there was another group in Melbourne and Victoria, and we worked over 2019 to 2020 to improve the website. One of the main things that came out of that process is that we translated the website into 8 other languages: Arabic, Chinese, Simplified Chinese, Spanish, Korean, Turkish, Vietnamese, Persian, and Assyrian. And our much loved workbook is also available in those 8 languages. It's also in more plain English than the original. We've also recently just translated our self-care hub into those languages as well, because self-care, as we've discussed many times with consumers, is an important skill to take with you on your NDIS journey. So in addition to the resources across the website that are really informative and available in those multiple community languages, there's a multicultural hub, was a big piece of work that was done by those 2 groups, and there's a lot of resources on there to explore. There's a podcast, there's a lot of stories and animations. For example, David shared his story there, and Mesa shared her story. There's also animations of the carers' journey, because carers are often forgotten in this process. And there's stories from Gina and Mei Ling and Nick. There's also an e-learning that we've done that looks at mental health, the NDIS, and stigma and discrimination, which is available in a number of languages as well. So just again, if you'd like to order any of the resources, printed copies of those workbooks in other languages, then please feel free to email us at reimagine@mhcc.org.au. There's, as I've mentioned, a lot of other resources to explore on Reimagine today. And there's stories, it's all based on people's lived experience, and then exploring some of the skills that are important for the NDIS journey. So things like self-advocacy and decision-making. Oh, and finally, our workbook in plain English is also available as an app, which you can get from Google Play or iTunes. So finally, I'd like now to welcome all of our panelists back to have a quick Q&A to round out our session. And thanks everybody for joining me again. Hopefully we can get to all of our questions. We didn't get too many come through, so fingers crossed. First off, okay, how can NDIS services create a culturally responsive and safe environment?
I might like to kick off this answer to that question. I think the person who asked this question is very up to date with the terminology. So culturally responsive is the latest way to describe it. It's you have to be responsive to people who are from a different culture, from belief system that might be different to you. And cultural competency training started more than 30 years ago. And a lot of the service providers should have their training when they are interacting with people from multicultural background, from Khao background. But to simplify it, I would say it boils down to one word: respect. So you respect people who have a different worldview to you, or have different cultural practices to you. And I have been to quite a lot of NDIS related forums, and even bilingual support workers who speak the same ethnic language doesn't mean that they have this culturally responsive attitude, and they could just judge you like what the other panelists were saying. You're so greedy to ask for so much funding. But we just have to be very careful, and I hope that the NDIA will run specific training to make sure their staff are culturally responsive. And one other thing is a very important attitude is being person-centered. You provide services that are person-centered. The consumer, the NDIS applicant, is in the center of this whole package of services. And this is really the whole driving principle of NDIS. Payment is tailor-made to individual needs and to empower the consumers to take control. So being culturally responsive also means that you try to understand the cultural interpretation of the person who's seeking service, how they understand their own condition, how they describe it, and listen to them, and not try to judge people who hold different beliefs. And one other last word is we don't want to make it to cause more harm. So I think the question is how to make sure that this is a safe environment. And one thing is to make sure you don't cause not to add more harm when you're providing service. So that is my take on that question.
Wonderful, thanks, Phoebe. And that's such a complex topic, and thanks for the overview. I think people can do a lot more learning in that area. Given the higher chances of the occurrence of language barriers with CALD communities, how are consumers made aware of the NDIS?
So for this question, I can't answer on behalf of the NDIA, but I can talk a little bit about the program that I've been involved in, which is the Community Connector program. So it's actually due to wrap up at the end of June, but that program was focused on reaching out to communities in areas where there was a high CALD population, doing lots of community outreach and active engagement, promotions in community languages, and providing information and resources in community languages as well, so that people could improve their knowledge of the NDIS and their understanding, and were more able to connect to NDIS services and supports. There's also work being done by a lot of other organizations, so community organizations and services like EMDA. So things that are really important for helping CALD communities to understand the NDIS are things like resources developed in community languages, so like what Elizabeth was speaking about on the Reimagine website as well. And really doing that active community outreach and engagement. So going out to communities and speaking with people directly to sort of let them know about the NDIS, build awareness. We also have multilingual staff at EMDA, so we're able to help consumers in their preferred language, as well as having an interpreting and translation service. And as well as that, connecting to community organizations, so schools, neighborhood centers, and working to build staff's knowledge and understanding of NDIS, so that people who are sort of interacting day to day with people who maybe do need support from the NDIS, they can help them connect to relevant supports and services as well.
Great, thanks very much, Harley. David, did you want to quickly add anything to that one, or do you think Harley covered most of it?
Yes, she's talking very well. Yeah.
Yeah. Well, I know, for example, that you do a lot of work with your peer cafe work, and I think you've mentioned before getting people to come to events and connecting with people in their own community can be really important. So I think like the work that you do supporting other peers with the peer cafe is really
okay. If in that case, I can add something.
Okay.
Yeah. For as I mentioned before, I have a Chinese peer support group. When that's 1 year, you know, after I joined the NDIS, so I saw so many, you know, my background people, when they apply for the things and then they assess the service, is so hard, so many barriers. So I just set up and run the group. And the first things, okay, there's a lot of help, you know, there. Okay, like today is MDA and the Mental Health Council list all the things another organization, you can get help. Second, you know, the local council and even the MP, all the resources. The program, when they move further or something, I feel, you know, my group people and me, we build up our confidence. That's very important. Before they don't know what to do, after they just got all the training, all things like that, they can speak up for their right, and normally, the cultural group, they don't want to speak, and they scared of the, for the mainstream, all the things like that. They just think they just keep quiet, all the things. So the confidence is very important, and they know where to find the support. So that makes things, really change the people's life, all the things.
Yeah.
Thank you.
Absolutely. Thanks for that, David.
That's all right.
So I'll go to the next question, which is, how do you best get an application accepted for complex trauma?
I'll answer this one. I guess the main thing to remember is that the NDIS is very evidence-based. So what they're looking for when an application does go in is all the attaching reports, medical reports, anything that you can obtain from a specialist, a doctor, even carer letters, doctor's letters, if it's a child, maybe a letter from a school counsellor. The more evidence you have, the stronger your application will be. And also it's important to remember that if you do have a psychosocial disability, you don't need to have it diagnosed. So any treating notes and things like that would be accepted as well. I think it's very important also to ensure that within those reports, it does detail how the disability that you're living with affects your everyday life, because that's what the NDIA want to see. They want to see that you do have a disability and also how it's affecting you every day. Things that might be simple for some might be a little bit difficult for you because of the things that you're going through. So yep, those are the things that they look for. Also, if you do get a response back from them and it's a rejection, you can take that letter and, show that letter to someone, a service provider, or at our organisation, we have a specific team called the NDIS Appeals Team. They can sit down with you and discuss with you why you were rejected. So the more information you know of why you were rejected, the better chances you have of trying to reapply or even asking for a review. And I know sometimes when you do fill out an access request form, it gives you a deadline of when you need to have all your information by. But I always say that taking your time is more important. So if you know that you have a medical appointment coming up soon and you know you're going to get a report, but it's after that deadline, you can always call the NDIA and just ask them for an extension and send that report in a little bit later. Because having that extra bit of information might make all the difference with your application.
Wonderful. Thank you so much, Farida. Phoebe, you wanted to add?
Yeah, I just want to add one more point. I think it was mentioned that sometimes when you put in your application, you think of bad days. And I actually went to one of the workshop with a appeal workshop, how you can appeal for the assessment is to think of the worst day scenario. So this is not just bad days, it's really the worst day scenario. So how it will, what will you be like, and how that affect your daily living, how it affect how you might not even be able to get dressed, get out of bed. So think about your worst day scenario, and then maybe the better days and something in between. So the plan is to help you to overcome all these challenges and put in like your worst day scenario. We hope that it won't occur very frequently, but that is one thing that we learned from the appeal workshop.
Absolutely. Thanks for adding that, Bibi. So my next question is, or that's come through, is I've got an NDIS plan and I'm not happy with it. What can I do?
I think just before I mentioned as well that there's definitely you can also go for a review. So there are a few organisations that can help, but usually it has to be within a certain time period. And I think with our team here, it has to be within the 28 days of getting that decision. But that doesn't necessarily mean that you can't move forward and request a review. So that would be a review of a reviewable decision. So all the information you need can be found on the NDIA website, and it's a couple of different ways that you can request for the review. And also, once you do request the review, it's important to have information attached to it as well, if you can. So if you are asking for more funds for certain things, then it's important to have evidence as to why you think you need more funds for that certain category. And like I said, there's a lot of different organisations out there that would be able to help you through that review process.
Thanks, Frida. And David, did you want to add anything to that?
Yes, but when you do the interview, like that I already mentioned, and sometimes I just talk about the mental health. I know the difference from physical and intellectual. Okay, it's really hard, for you to explain all the same things. Like I mentioned before, I don't even understand how they work out that one. So you need to have a really good, the psychiatrist, the psychologist support document or something. Yeah.
Yeah, for sure. Okay. So the last question that's come through, and it's more of a comment than a question, but it's from a mother, and she said, "I am too exhausted as a mother and have too much on my plate to try and get the NDIS for my son with a mental health diagnosis." So, yeah, as I said, that's more of a comment than a question. But for my final question, do you have any, each of you, I'd like for you to answer this, do you have any advice either for this mother or generally for the viewers watching today?
I might just mention how David's been running a fabulous support group. I've been to, as a guest speaker, to share some of my knowledge about how to advocate for yourself and being assertive. But I think one very important thing is you are not alone. Like going to those support group, you can see other people having similar experience, and as a group, you support each other. I think that's really something that can help this mother.
Thanks, Phoebe.
Okay. For this one, I'm sorry for that one. And that's so many people, I said before, I'm very easy to get in, the NDS. My group have another lady. Her situation is very similar to my situation. Now she's 2 years, and she did all the appeal, all the things with MDA. Now is at the AAT with the legal aid, all the things involved is still going on. So I know how much for the hard, sometimes I just don't understand. The thing is, my advice is you try to all the resources, okay? Like, sometimes, you get support from your local MP, all the organization, all the things like that. But very important is you have to know, okay, just keep doing it, okay? Some, good results may be waiting for you. That's all I just say. Thank you.
Thanks very much, David. Frida, Harley, any final advice for our viewers?
I think as well, it is a very common situation, but remembering that there is support out there that can help guide you through the process. It can be a very long and sometimes challenging process. There's a lot of information that's required for applications, but there are people like advocates or LACs that can help you in terms of what information you might need, sort of talk you through the process, be there as a support for you. And that can be something that's really helpful, so it doesn't feel like all of the pressure is on you.
Absolutely.
Yep, just to follow on what Harley said, yeah, there are definitely a lot of organizations that can help you, and also they can help you in the way that you can do it in your own time. So I know because of COVID recently, we're meeting a lot of people over the phone instead of in person and having them come into our office. So whatever is easier for you. I mean, even sometimes I'm communicating with people over long stretches of period because it's just over emails instead. So I think being a mum is a very, very difficult job. But I think it's also important to address the issues and also get the help and support that, you know, your son might need. Yeah, there's also, I think the Reimagine website is a really great source as well. So going in there, seeing other people's stories and reading up on the information and seeing how forms are filled out is a really good start as well. There's no rush, and most organizations can take it as slow as you would like to and work within the timeframes that you have. But I think it's a good idea to get that ball rolling and start the process as soon as possible.
And I think on that note, the Reimagine website, those workbooks that have been translated into the 8 different languages, they are very good starting point. You can take your time, do 1 page at a time, and just get all the question answer on your workbook, and that could be your application already. So, and I'm sure a lot of organization can give you the support, but just do, do it at your own pace.
Thank you so much, everybody. Yeah, so thanks again to Bibi, David, Farida and Harley, and to all of you guys online for joining us today. That's brought us to a close and we've gone over time. So again, if you have any questions or feedback, please email us at reimagine@mhcc.org.au. You can also email me at elizabeth@mhcc.org.au, but that's Elizabeth with an S. And just finally, as this webinar contains some content that may have been stressful or distressing, I'd recommend that you debrief with somebody afterwards. Just chat to somebody about how it made you feel or your thoughts about what we've discussed today. And if you'd like, you can also reach out to a support line like Beyond Blue. They're on 1300 224 636, and they've got brief counselling and referrals. Or if it's an emergency, call 000. Take care and stay safe. Bye, everybody. Thanks.